Next thing we want to talk about is thrombosis, and thrombosis is basically formation of these thrombus in patients' vessels. They are characterized by lines of zone and attachment to the vessel wall. So imagine that you want to investigate a patient's corpse and you want to see if these thrombus was the cause of death. Now you may ask yourself how thrombus can occur in a dead person, and that's because when the person obviously is dead, there is no blood circulation, and the stagnation of blood can cause thrombus itself. Now, the question that may arise here is that how do we recognize whether these thrombus were formed pathologically or it was formed post-mortem? One of the way you can locate that is with line of zone, and these lines of zone are basically when we have lines of red blood cells and then we have lines of fibrins. So causes of thrombosis are basically divided into three categories. The first one is disruption in blood flow. Now, disruption in blood flow can occur due to immobilization, because when there is immobilization, the blood is not moving as it normally flows, so that can cause a stagnation of blood, and that may cause thrombosis. The other thing can be due to cardiac valve dysfunction. So here heart is not pumping blood properly, and that causes change in circulation of blood flow, and that can cause thrombosis. The other one is aneurysm, which is under the category of disruption in blood flow, and that's because imagine that we have aneurysm, and due to aneurysm, blood is circulating or is moving in a peculiar way, which is causing this stagnation here again in the aneurysm region, and that can cause a thrombosis. The other causes of thrombosis can be endothelial cell damage. We know that endothelial cells are producing all or releasing all of these enzymes that are preventing any sort of thrombus formation. So when there is any sorts of endothelial damage, these endothelium cannot release these enzymes properly, so that can be a cause of thrombosis. Now, some of the reasons are atherosclerosis, vasculitis, or high levels of homocysteine. Alright, now the last cause of thrombosis we can mention here is hypercoagulable state. Obviously, when the patient is hypercoagulable, then the chance or the odds of thrombosis is higher.